Welcome to this series about studying and learning skills for undergraduate medical students. My name is Mohamed Hassan Taha. I am the director of the Medical Education Centers, and we are producing these videos to support undergraduate medical students with essential skills for their learning and studying in medical schools and health science schools. This is the 11th video of the series related to studying and learning skills. And today's video will be about problem-based learning. And I encourage you to attend this video and another two videos which related to problem-based learning. The next video will be about how students learn and their role in problem-based learning. And the last video in this series will be about the learning process in problem-based learning. So these three last videos are closely integrated with each other. I encourage you after the end of this video to go and watch the 12 videos and video number 13. So today's video will be about problem-based learning in health science education, principles and practice. And the session will be about the definitions and the educational principles of problem-based learning, rationale of problem-based learning, role of problems tutors, and we'll just overview, but we'll have specific sessions about their roles and how to learn through problem-based learning. Let us start with the history. The problem-based learning is relatively not new. Start McMaster, Canada, 1974, Maastricht, 1976, Newcastle, Australia, 1976, in Africa, in Jazeera and Suez Canal, Jazeera University in Sudan, and Suez Canal in Egypt, 1978, and in Arabian Gulf University in 1982, then in the GCC countries here in Qasim University, 2010, following Arabian Gulf, and here in Sharjah, 2004. And nowadays, most of the universities across the world are using problem-based learning. So why problem-based learning? Basically from the principle that tell me and I forget, teach me and I remember, involve me and learning, and I will learn. So learning is about involvement. And as far as the learner is a part of the learning process, the learning will take place in a good way. And spoon feeding will be like this, as you can see here in the screen. Spoon feeding will be like this. We feed the student, and then the student will forget at the end. So what is a problem-based learning? It is a learning methods based on the principles of using the problems from its name, problem-based, as the starting point for the acquisitions and integration of the knowledge. So in traditional learnings, they told you what you need to know, you memorize it, and then you have the problems at the end of the exams. While in problem-based learning, you assign with the problems, you identify what you need, and then you learn how to apply it. So the starting point of the learning process here is a problem. There is no more spoon-feeding in problem-based learning like this. In classical approach, in problem-based learning, there is no spoon-feeding like this. There are different formats in problem-based learning, including the written case, the videos, maybe lab results. You can receive X-ray as a starting point, or patient scenario, or patient in clinical practice, or virtual problem-based learning, maybe using the new format. And actual problem-based learning, if you can look here, it is authentic learning approach, because it is very close to the reality in practice. This is the traditional small group learning. The tutor sit here, and the discussion is between the student and the tutor directly. While in problem-based learning, students lead the group, and the tutor or the facilitators join the group as participants. And learning, problem-based learning is anchored on learning principles. And this is important three C's, which is constructive learning. Learning will take place when you build on the prior knowledge, contextual learning, because it's related to the context, and collaborative learning, in which group of students will learn with each other. And learning is promoted when the learners activate their prior knowledge, like here constructive learning, organize and structures knowledge, which is contextual learning, and then engage and solve or discussing meaningful problem as a collaborative learning approach. Problem-based learning, based on the studies, based on evidence and experience of the students, it shown to enhance the self-directed learning for the students because they search, they learn. It helps the learner to be problem solver, to be leaders by leading the group, and to develop presentation skills, to develop teamwork and being good collaborators, and to be a good communicator. Also to be a self-learner because with the expansion in the knowledge and we are in the era of the advancement of the knowledge and medical education, we need to develop the skills of self-directed learning. So in problem-based learning, there are the three pillars: the problem, the student, and the tutor. The role of the problem is describing set of phenomena or events. And students use this problem case scenario or whatever the format, use the triggers from the problem case to define their learning needs. So in a summary, the role of the problem in problem-based learning to support you to develop problem-solving skills, to develop your critical thinking and reasonings and weighting of evidence. It integrates different disciplines, including behavior, and it helps you to think as like a professional because when you receive the patient in your practice, you receive as a problems, not in like a discipline format, anatomy, physiology. No, you receive it as a problem. So the role is to support you to learning how to learn, and to support you to develop the problem analysis, identify the gaps of the knowledge, and to help you to deal with the future problem. It is very important as students to know the tutors and very important skills that the tutor in problem-based learning should have. The good tutor is the one who be able to provide you with the frequent feedback, to promote the integrations of the learning, ask questions and probe reasoning process, to help you to balance basic and clinical science in the problems, to encourage the critical appraisal of the informations, and to encourage students to encourage you to take control of your learning process and to facilitate and support good interpersonal relationship in the group. So this is the role of the tutors in problem-based learning. So classical, we say a teacher. Now here the name is tutor. Classical role of teacher is to disseminate information, while in problem-based learning is to facilitate the learning process. So here, the term here is a moderator or facilitators or tutor because to facilitate the learner process. So the role of the tutor here is to facilitate the learning process, to keep students to the curricular context related to problem, and to build professionalism during discussion and how to deal with this problem in the future. And the role of the tutor is to be a guide by side, not say on the stake. This is very important. And to be like a ghost, not as a host. So the best term to describe the role of the tutor in problem-based learning is to be actively passive. So this is what exactly tutors do in classical way and traditional tutor. But here in problem-based learning, the tutor is joining the group as a member, while the leaders, as you can see here, is leading the discussion. What is the role of the student? The role of the students is a tutorial. Is they are a learner, they are a leader, they facilitate the discussion, They are recorder, they are collaborator, critique, constructive evaluators, encourager, active discussant, knowledgeable about the process, punctual, come on time, committed, and some of them will act as scribe to take the note. The next slide will describe the role of each one. So the role of the leader or the chair of the group is to lead the discussion of the group and to encourage every student to participate in the discussion, to maintain the group dynamics and to keep time, to ensure group keeps to task on hand, and to ensure scribe can keep up and is making the accurate record. For the scribe to record points made by the group, to help group orders their thoughts, participate in discussion, and also record resource used by the group. For the other group members, they have to follow the steps and participate in the discussion, listen to and respect the contribution of the others, ask open questions, research all learning objectives, and search information with others. And the role of the tutor is to encourage all group members to participate, assist the chair in some occasions with the group dynamics if there is any corrective measures to be taken, check scribe, keep an accurate record, prevent any side talk, sometimes to support the leader, ensure the group achieves the learning outcomes, check the understanding and assess performance. Problem-based learning, there are several formats to learn in a problem-based learning, and the common one is the 7-step approach or 7-jump approach developed by Maastricht University. But in a principles, there is a problem. There is a first session in which there is a brainstorming, identify your needs. Usually the first session at the beginning of the week. In the end of session, this session is to determine your learning needs. Then students will get new information at the end of this session, and then the second session will be considered as a wrap-up session in which students exchange and transfer the knowledge. So this organized in, there is 2 sessions, the first session at the beginning of the week and the second session at the end of the week, and there is a learning support in between. 5 steps in the first sessions, also called 5 jumps. You start when you receive the problem, you clarify the terms, you define the problems, and then you analyze the problems, you summarize it, doing initial concept map, and then you formulate the learning needs. This is in session 1. Then students will go for self-study or having some sessions, lectures, clinical skills related to this problem, and then come together in the second session at the end of the week for reporting back to the group. This diagram shows the steps. The first session starts with clarifying the difficult term. The first step, then define the problem, then analyzing the problem, brainstorm, initial concept mapping by problem synthesis, systemic classification, and then the learning needs at the end. Then they will go for self-study and lectures, clinical skills, tutorials in between, and then come back for reporting. So this is just an overview of problem-based learning and the process. Thank you so much for watching this video, and I encourage you to watch the second video related to this problem-based learning session and the 12th session in this series related to studying and learning skills. See you there.